Welcome to ClearPath NCLEX, your clear path to nursing success. In this lesson, we're going to tackle acid-base balance, and we'll do it with simple explanations, really clear diagrams, and of course, those all-important NCLEX tips. All right, so here's our game plan for today. First, we're going to lay down the fundamentals. Then we'll dive into respiratory and metabolic imbalances. After that, we'll see how the body fights back with compensation, and we'll wrap it all up with some NCLEX practice questions and essential safety tips. Okay, first things first. Let's really get down to the basics. Why is this whole acid-base balance thing so critical for, life itself? So what is it really? Well, think of acid-base balance as the body's full-time job of keeping your blood pH in this super, super narrow range. And that magic number you need to know is between 7.35 and 7.45. If it goes too far in either direction, things get dangerous. And the two superstars in charge of this delicate balancing act, that would be your lungs and your kidneys. All right, take a deep breath because you are going to want to tattoo these numbers onto your brain. I'm kidding, mostly. These are your normal arterial blood gas, or ABG, values. You've got your pH, of course, then PaCO₃, which is just a fancy way of saying carbon dioxide. Next up is HCO₃ negative, that's our bicarbonate. And finally, PaO2, which is oxygen. We're going to be coming back to these numbers again and again, so really get comfortable with them. Okay, if you remember one thing from this whole section, let it be this. It's so simple but so powerful. Just think, CO2, carbon dioxide, is controlled by the lungs, and it's always our acid. Got it? Lungs, CO2, acid. Then, on the other side, we have HCO₃ minus, bicarbonate. That's the kidneys, and it's always our base. Kidneys, bicarb, base. Seriously, getting this down is half the battle won, I promise.
Okay, now that we have the basics down, let's start putting the puzzle pieces together. We're going to jump into our first set of imbalances, the respiratory ones. So these are the problems that start when the lungs are the source of the trouble.
So, first up, respiratory acidosis. What's happening here? Well, the patient isn't breathing effectively. They're hypoventilating. So they're holding on to way too much CO2. And what did we say CO2 was? Our acid. So more acid means the pH drops below 735. A fantastic way to remember the common causes is the mnemonic depress, because all these things depress respirations. We're talking drugs like opioids, edema, pneumonia. You can see the list here. It's anything that makes it harder to breathe out that CO2.
Okay, so you walk into the room, you see this patient. What do? For the NCLEX, your number one priority is always the airway. We have to improve their breathing, so think about administering oxygen. But remember to be really careful with our COPD patients. We'll encourage coughing and deep breathing. And here's a huge safety alert. You have to monitor for hyperkalemia or high potassium. Why? Well, when the blood is too acidic, the body tries to fix it by pushing acid from the blood into the cells. But to do that, it has to trade, and it pushes potassium out of the cells. It's a direct swap, and that's why you see high potassium in the blood.
All right, let's flip the coin and talk about the exact opposite, respiratory alkalosis. Now, instead of breathing too slow, our patient is breathing way too fast. They're hyperventilating. They're blowing off all of their acidic CO2, and with less acid, the pH goes up, becoming more alkaline, above 7.45. And just like before, we've got a great mnemonic for you, tachypnea. This covers things like a high temperature, anxiety, pain, basically anything that would make someone breathe really, really fast. So for this patient, what's our priority? We have to treat the reason they're hyperventilating. If it's pain, manage the pain. If it's anxiety, help them calm down. We're going to encourage them to slow their breathing, maybe with a rebreather mask to help them rebreathe some of that CO2. And just like acidosis had its electrolyte buddy, so does alkalosis. Here, you need to watch for low potassium and low calcium, hypokalemia and hypocalcemia. Okay, we've covered the lungs. Now let's switch gears and talk about metabolic problems. This is when the issue isn't with breathing, but with the kidneys or some other process in the body. With metabolic acidosis, you'll see the pH drop below a 7.35, and this time, the problem is with our base, bicarbonate, which also drops. So what's going on? Well, it's one of two things, really. Either the body is making way too much acid, think DKA or sepsis, or it's losing too much of its base. The classic example of losing base? Diarrhea. And of course, if the kidneys are failing, they can't get rid of acid like they're supposed to, leading to the same problem. Now, a huge clinical sign you need to know for this is Kussmaul respirations. You'll see the patient breathing really deep and fast. What are they doing? Their lungs are trying to save the day. They're trying to blow off as much acidic CO2 as they can to compensate.
As the nurse, your job is to treat the cause. If it's DKA, insulin is the key. You'll give IV fluids, and just like with the other acidosis, you're going to be watching that potassium level and the ECG like a hawk. And on the other side of the metabolic coin, we have metabolic alkalosis. Here, both the pH and the bicarb levels are high. Think about where you see this on the floor. It's often from losing too much stomach acid. So we're talking about patients with severe vomiting or who are on NG suction. You're literally suctioning the acid right out of them. Taking too many diuretics can also cause it by making you lose potassium. So our nursing priorities here are, you guessed it, to treat the underlying cause. We'll be giving IV fluids to replace what's been lost, paying super close attention to electrolytes, especially potassium. That means you're watching for hypokalemia and any weird rhythms on the cardiac monitor. And if diuretics are the culprit, you'll likely be holding those based on the doctor's orders. Okay, so we've talked about all the ways this can go wrong, but the body is pretty amazing, right? It doesn't just sit there and take it. It tries to fight back. Let's talk about how it does that through compensation. And then I've got some of my favorite pro tips to help you crush these questions on the NCLEX.
Compensation is really just the body's backup plan. It's like a buddy system. If the problem is metabolic, so the kidneys are in trouble, the lungs jump in to help. They'll start breathing faster to blow off CO2 or slower to hold on to it. Now, if the problem is respiratory, the lungs are the issue, the kidneys will come to the rescue. They're a little slower to act, but they are powerful. They'll start tweaking how much bicarb they save or how much acid they pee out. The whole goal, no matter what, is to get that pH back into the safe zone. Okay, screenshot this, write it down, do whatever you have to do. These are the pro tips that will get you through the NCLEX. Here's your step-by-step process. Step 1, look at the pH. Is it high or low? That tells you if it's acidosis or alkalosis, period. Step 2, find the culprit. Is the PaCO₃ or the HCO₃- the one that's out of whack and matches the pH? Step 3, don't forget about potassium. Remember, it moves in the opposite direction of pH. So acidosis equals high potassium, alkalosis equals low potassium. And the most important rule of all, we treat patients, not numbers. The ABGs have to match what you're seeing in front of you.
And of course, we can't talk about ABGs without talking about the best mnemonic ever. ROME. Respiratory opposite, metabolic equal. What does that mean? It's simple. For respiratory problems, the pH and the PaCO₂ will move in opposite directions. One goes up, the other goes down. For metabolic problems, the pH and the HCO₃- move in equal directions. They both go up together or they both go down together. It works every single time.
Okay, you've learned a ton. Now it's time to put it all into practice. Let's do some questions and then go over a few final safety points that are absolutely critical, both for your exam and for when you're a practicing nurse. When you have a patient with an acid-base imbalance, these are your non-negotiable safety priorities. First and always, your ABCs, airway, breathing, circulation. That comes before anything else. You are going to watch their potassium level like a hawk, because those shifts can cause fatal heart rhythms. A huge point, you never ever correct these imbalances too fast. Slow and steady wins the race. And because of that potassium risk, continuous cardiac monitoring is often a really good idea. All right, let's test your skills. Here's a classic NCLEX-style question for you. A client with COPD has the following ABGs. pH is 7.29, PaCO₂ is 55, and the HCO₃- is 25. So how would you interpret these results? Go ahead and pause if you need to. Think about your steps. Maybe use ROME. Okay, did you get it? The correct answer is C, respiratory acidosis. Let's walk through why. First, look at the pH. 7.29, that's low, so we know we're in acidosis. Now, let's find our cause. The PaCO₂ is 55, which is high. That's acidic. The bicarb is 25, which is totally normal. So, the pH is low and the PaCO₂ is high. Are they moving in the same direction or opposite directions? Opposite, so respiratory, opposite. It fits perfectly. And that's a wrap on acid-base balance. I'll leave you with one final thought to keep your critical thinking gears turning. What would be your most critical assessment for a patient who has metabolic alkalosis and hypokalemia? Think about what body system is most at risk. It's thinking through questions like that that will truly set you up for success. Thank you so much for learning with ClearPath NCLEX. If this helped you, please like, share, and subscribe for more content to help you pass your exam.